Students, let's see how many questions you get right out of these 50 questions. Question number 1. Which chamber of the heart receives deoxygenated blood from the body? Right answer, option C, the right atrium. Question number 2. Which blood vessels carry blood away from the heart? Option A is the right answer, the arteries. Question number 3. Which blood vessels have valves? Right answer, the option number D, veins. Question 4. Which artery supplies oxygenated blood to the heart itself? Right answer, option B, the coronary artery. Question 5. What is the normal resting heart rate in adults? Anything between 60 to 100 BPM. Question 6. The largest artery in the human body is the aorta. Option A is the right answer. Question 7. Which blood vessels are known as exchange vessels? Right answer, option D, the capillaries. Question 8. The heart is enclosed in a protective sac called option B, the pericardium. Question 9. Which part of the heart pumps blood into the lungs? Option C is the right answer, the right ventricle. Question 10. Which ion is essential for blood clotting? Option A is the right answer, the calcium ion, the Ca+2 ion. 11. Which valve prevents backflow of blood into the left atrium? Option D is the right answer, the mitral valve or the bicuspid valve. 12. Which chamber has the thickest muscular wall? Right answer, option B, the left ventricle. Question 13. Which part of the ECG represents ventricular depolarization? Option C is the right answer, the QRS complex. Question 14. Which cells in the heart generate electrical impulses? Option A is the right answer, the SA node. 15. Which vein carries oxygenated blood? Option D is the right answer, the pulmonary vein. It is the only vein that carries oxygenated blood. 16. Which hormone increases heart rate? Option B is the right answer, the adrenaline. 17. Which structure separates the left and the right sides of the heart? Option C is the right answer, the septum. 18. What percentage of blood is plasma? Approximately 55%. 19. What causes the lub-dub sound of the heart? Option D is the right answer, the closing of the valves. 20. Which vein brings deoxygenated blood from the lower body? Option B is the right answer, the inferior vena cava. 21. Which part of the heart pumps oxygenated blood to the body? Option C is the right answer, the left ventricle. 22. The heart is made of which type of muscle? Option A is the right answer, the cardiac muscle. 23. How many liters of blood does an average adult human have? Option D is the right answer, 4 to 6 liters. 24. Which blood vessel carries deoxygenated blood to the lungs? Option B is the right answer, the pulmonary artery. It is the only artery that carries deoxygenated blood. 35. What is systolic pressure? Option C is the right answer. Pressure when the heart contracts. 26. The pacemaker of the heart is called. Option number E, the SA node. 27. Which protein in RBC carries oxygen? Option number D, the hemoglobin. 28. Which structure prevents backflow into right atrium? The tricuspid valve. 29. Which artery carries deoxygenated blood? Option C, the pulmonary artery. 30. Which organ is responsible for destroying old RBCs? Option A, the spleen. The spleen is known as the graveyard of the RBCs. 31. Which part of the brain regulates heart rate? Option B is the right answer, the medulla oblongata. 32. Cardiac cycle duration is approximately 0.8 seconds. 33. In fetal circulation, blood bypasses lungs via. Option C, the foramen ovale. 34. Which node receives impulses after the SA node? The AV node. Option A is the right answer. 35. What is the function of the coronary arteries? Option B is the right answer. Supply of blood to the heart muscles. 36. Which condition is caused by the blockage of coronary artery? Option D, the heart attack. 37. What is the normal cardiac output in a healthy adult at rest? Option C, 5 liters per minute. 38. Which artery is commonly used to measure blood pressure? Option A, the brachial artery. 39. The pacemaker potential in a AC node is mainly due to the entry of. Right answer, option B, sodium ions. 40. What prevents the backflow of blood from the pulmonary artery into the right ventricle? Right answer, option D, the pulmonary valve. 41. Which blood vessel has the lowest blood pressure? The veins. The veins has the lowest blood pressure. 42. The term diastole refers. Option B, relaxation of the heart chambers. 43. Which protein helps in maintaining osmotic pressure in blood? Option B is the right answer, the albumin. 44. The bundle branches transmit impulses to the. Option D, Purkinje fibers. Option D is the right answer. 45. Baroreceptors that regulate blood pressure are located in the. Option C, carotid sinus. Option C is the right answer. 46. Which chamber of the heart receives blood from the pulmonary veins? The left atrium. Option A is the right answer. 47. The hematocrit value primarily indicates the percentage of the RBCs. Option B is the right answer. 48. The coronary sinus drains blood into the. Option D is the right answer, the right atrium. 49. Which blood vessels have the highest total cross-sectional area? Option C is the right answer, the capillaries. 50. The closure of which valve produces the dub sound? Option A is the right answer, the semilunar valves. Option A is the right answer for this question. Students, here comes the end of the video. If you have enjoyed this video, please do like the video, share the video with your friends, and if you haven't subscribed to the channel, please subscribe.